This is Kathy, and we're going to treat her with ThermiGen to her neck and to the jawline here. That will help treat this area that's hanging down a little bit. We'll be able to tighten the skin as well as treat the fat, and then tighten up the jawline in this little bit of area right in here. So what we're going to do with the ThermiGen is heat up the fat in this area as well as the skin, and the same thing right in here. A little tiny bit of fat pad here and the skin. And to get there, I'll put a little numbing medicine right here, a little behind each ear, just in the lobule. And those are going to be the ports that I use to get in to treat the areas. Now there's a little tiny nerve back here that if I inject that, the whole neck will be completely numb and you won't feel a single thing. How's that sound? Good, good. So the first thing that we're going to do is treat some of the fat that's in here. And that's what's nice about this is you can treat fat, you can treat skin, you can treat the nerves. There's a few little even skin lesions that you can treat with this. But what we're going to do is introduce this cannula into here. I put my local in using a 22 gauge needle. So this is 22 gauge, so that's all I got to put in here. And because we're treating fat, is best treated at 65 degrees Celsius. So what I'm going to do is I'm going to put it into the fat that I'm working on, step on the pedal, and let it heat up to 65 degrees Celsius. And once it gets there, I'm going to be able to move it around and treat the fat. All right, and so I just slowly move it. As long as I'm just below 65, it'll continue to do the energy to that area. And I can actually feel it. I can feel in there the fat just kind of bubbling a little bit. You doing all right, Kathy? Mm-hmm. All right. And there we go. So this submental area right in here with a little submental fat pad, I've actually treated to 65 degrees Celsius in that area. And you can actually feel loss of integrity of the lobular feel to the fat, and actually you can push and a little bit of free fatty acid comes out. Next we're going to treat the skin. Now the skin we want to get to about 50 degrees Celsius subdermally, and to achieve that I'm going to set the device on 51 degrees, and I'm going to work in areas. I'm going to start at the midline and treat here, and I'm basically going right up against the dermis, and I'll take that right down to where I want the cervical crease to be, or if there's a little bit of fat or thickness below that, then I'll go right below it. So I have my probe here, we have this here, we have the machine set on 51 degrees. So, and we've just found that at 50 degrees Celsius, provides the optimum contracture of the dermis. All right, so I spent 2.5 minutes from the midline over to the anterior border of the sternocleidomastoid up to the mandibular border. And now we're going to reset it, the time. I'm going to do the other half of the submentum. All right, and that's it for the submentum. Both the fat, which I treated for 1.5 minutes to 65 degrees Celsius, and the skin from the cervical crease superiorly to the inferior border of the mandible and posteriorly to the anterior border of the sternocleidomastoid. And I treated it for a total of 9 minutes. 4.5 minutes on each side. So now I'm going to treat the skin just along here, just to give it a little bit more tightening effect. I'm going to go in from behind the ear, using our same little port, just anterior to the marionette line. Step on the pedal, and away we go. And I'm just going to do a little minute in here, is what I have found helps out quite a bit for helping define that angle of the mandible. You see a smile? See? There was a few twitches here and there. However, I didn't heat it up enough where that would cause any long-term or any even short-term problems for the marginal mandibular nerve. I'm going to do the same thing in this area just behind the marionette line. And we're gonna, it's still unpulsed. And say if I go a little too deep or superficial, you could actually see some movement there. There we go. You can see some twitching. But we're still getting a little bit of heat there. And I'm just going to treat that for 30 seconds. Let me see a smile. And it's perfectly fine. It looks great. Let's move over to the other side now. Right up against the dermis, all the way to that marionette line. And step on the pedal. And that's a good 30 seconds, and that's it. All right, so how was it?
It's good.
And this is immediately after ThermiGen to both the skin and to the fat. And look at that, we've taken care of the fat in there. We're already starting to see some of the short-term tightening that occurs just from the heat right off the bat. Minimal swelling. Yeah, sometimes you'll get a little bit of bruising, but that's very much on an individual basis. And we'll have her do some herbal supplements and things like that. We already know that Kathy here is kind of a bruiser anyway, so we implement those things right off the bat. Now let me see you smile. See you pucker your lips. All the nerves are working. How's it feel? Cool. Well, then that's it. We're done. Well, we've just finished doing the ThermiSculpt to treat the neck and the jowls on Kathy. Well, what we did, once again, was treat this area here and here with the ThermiGen, and this is immediately afterwards. A little bit of swelling, but as you can tell, that fat pad is now gone. We had before, which we could grab a hold of, it's now gone. And there is still some local in there, but even with that local, you can already tell a difference. And every day it's just going to get better and better and better. All right?
Thank you.
Thank you.